Hello everyone, and welcome to the fourth in our series of Light Sensitivity Awareness podcasts. My name is Rodney Mountain, and today I'm here with Professor Sally Ibbotson and Anne Severwright, one of our patients. We're recording from the Scottish Photobiology Service in the Photobiology unit at Ninewells Hospital. And we're here today to discuss light sensitivity. This series of podcasts is part of an ongoing patient engagement work and process that our service is involved with. We're trying to raise awareness of light sensitivity conditions in order to reduce the time that it takes for patients to be referred to our services and also to improve the lives of our patients. So let's start with a few introductions. Could we start with you, Anne?
Yes.
Your background and who you are?
My background is that I was self-employed for quite a while, and I began to suffer from aches and pains. It takes me back, and it's
to those early days,
very painful in the early days. It took a long time for my condition to be diagnosed, which I was diagnosed with chronic fatigue syndrome after many years of going from hospital to doctor to hospital and different situations. Over the years, I began to have skin problems and photosensitivity. And my life became almost at a standstill. My condition got so bad that I was housebound for quite a while at some stages, and it was a case of rehabilitation. I had a lot of heat treatment, physiotherapy, just learning to get myself back into normality in lots of different ways. It's been a slow progress. Skin condition flares up sometimes, and I can't get out of the house for days on end, because it affects my face mostly, not my legs, my arms, or any other part of my body, just from my chest upwards to my face and my head. I've had constant headaches over the years, but it's not been diagnosed as migraine or anything as such. But the photosensitivity keeps me housebound a lot as well. So it's just been a case of over the years pacing myself.
So it's had a major impact on your life for a long time.
Yes.
And things like work and your family and all those aspects of life.
I had to take early retirement and close my business down. And my family more or less became carers in different ways. So it's been very, very difficult, yes.
Yeah. And Anne, I think we are always interested to know this sort of journey as far as your skin condition, you know, when you started to become aware of a problem, that journey that you were on before a diagnosis was made, and how did that evolve?
I think the skin condition started to show itself a few years into my diagnosis of chronic fatigue syndrome, as did a lot of other things, joint pain, muscle pain, muscle
So there was quite a lot of overlap with things,
skin condition, the photosensitivity, everything just all seemed to come at the same time, or at different phases.
Yeah. And that journey to actually come to a diagnosis of your skin condition, how was that diagnosis actually made? Who did you see?
Well, doctors initially, and it was one steroid cream after another, and doctors saying you've got psoriasis, because at one point my scalp was full of sores and boils. I was in a bit of a mess. The creams didn't help. I'm trying to think what else had been prescribed. I can't really remember a lot of the prescriptions, but yes, there was...
It's a long way back, 30 years.
A lot. Eventually I was referred to the Royal Infirmary in Glasgow, which they did a lot of tests and experiments on my back to see what I was allergic to. There was a few things there which I then learned how to look at ingredients and items, cut out anything that had perfumes or anything like that. And after that, it was just a case of one day at a time. Sometimes I'd have a good day, a bad day, a good week, a bad week. I missed out a lot in life where family celebrations were concerned, weddings, funerals.
So that whole social impact's been quite big.
Socially, my life just became non-existent, and it was very, very difficult for family members to understand what was going on with me, because I never had the answers. I was living from doctor to hospital to clinic, didn't know what was what. And I believe also some of my symptoms are arthritic now. So it just seems to go from one thing to another. There's no end to it. And my life can be very restricted.
Yeah, and the restriction from the light side of things, what do you have to do
Well, I'm never without sunglasses. Never. Sometimes indoors. I like to read, and it's very difficult because I've either got to have a lamp behind me to shine down on what I'm reading. I can't have a lot of bright lights in the room. When I'm under fluorescent lights or spotlights, and I've got to turn them off. It just makes me feel I need to be in darkness. I just can't cope. Sunlight.
And coming into this room that we're in today as well, that's where there was a window, it's too bright. Yeah.
Things like that. I don't know the answer to it. I don't know what can be done about it. So I just cope on a daily basis.
Oh, it's really tough. I mean, do you manage to get outdoors and do things that you...
I try not to let it restrict me. But I really couldn't go outside without some eye protection. Yeah. I don't know how to overcome it. I don't know what the answer is. I don't think anybody does.
No. And I know very little about these specific conditions, you know, and just getting a feel for if you had a bad reaction, what would happen to you, to your face, to your upper part of your chest that you're describing? What actually happens?
It just totally flares up. It becomes red and raw and weepy. My lips swell. My eyes are red with... I just look like a lizard. That's the only way I can describe it. It makes me very, very uncomfortable. And I just don't want people to see me like that. So I just close the door. It can last for a few days.
And it lasts for a few days.
Yeah. I've had so many steroid creams and so many ointments and so many... I just don't know. I don't know what the answer is. It's not a good life.
It's a major impact on you. Yeah.
And I'm not getting any younger. I mean, I'm 71 now. You know, this has been half my life, living like this. And having to explain to people why I can't.
Very difficult.
Yes, because I look healthy. I mean, I've got all my makeup on today, you know, it's...
Would you mind if we turn to Sally just for an introduction and a perspective on things, Sally?
Thank you so much for coming today, Anne.
You're welcome.
Thank you, because I know it's difficult for you. So where we sort of come in to try and help is through the Scottish Photobiology Service, which is a service that's been set up for 50 years now, actually.
Wow.
And we're the only centre in Scotland that is available to investigate patients who have either suspected or confirmed abnormal sunlight reactions. And we're a clinical service, so we have sort of clinical members of the team. We also have scientific members of the team, medical physics doctors as well. And the reason is because the equipment that we require to use to try and work out if people are abnormally light sensitive or not does require very sort of careful sort of calibration in order to make sure that we know whether reactions are what we would expect for the normal sort of population background or whether they would be considered abnormal. But the testing that we do does allow us to help to identify whether somebody has abnormal reactions to sunlight or not. And you describe a sort of very long and quite complicated story where you've obviously had lots of very impactful symptoms, some of which are not related to skin and light, the chronic fatigue and the joint problems, and you obviously have lots of very difficult symptoms to manage. But the Scottish Photobiology Service, its role here would be to try and help out in terms of working out how much light is playing a part and what the role of light is, and if there are abnormal light reactions, which wavelengths of light are affected and can we help. And it was interesting in your case because the light testing, in fact, when we did the light testing, was normal, which is good in lots of ways, because what it means is that your reactions are not out with what we would expect for the sort of normal background population. So it's good news in one way, but what it also does show is that you give a very clear story where light is aggravating your condition. And if you don't mind me saying, I think your skin condition that you had, this redness and scaling and the weeping in the scalp and on the face, has been felt to be consistent with something called seborrhoeic dermatitis, which is your sort of skin diagnosis, if you like. And that actually is often aggravated by sunlight. So what I mean by that is sunlight is not causing the problem, but if you have the problem, sunlight can aggravate it. In the same way, probably, and I don't know if you feel other things aggravate it, but does heat or sweating or things like that aggravate it as well? Do you have other aggravating factors for it, or stress, or?
No, I'm living a stress-free life at the moment.
Okay.
I'm so laid back. I'm probably heat. Now that I think about it.
Yes, yeah.
Because having had a hormone condition for a long time as well.
Yeah.
I mean, I had a hysterectomy in my 20s and I had an early menopause.
Yeah.
So, I mean, and I'm getting more symptoms now that I'm getting older.
Yes, yeah. I understand that. And so I think, although here the light testing that we've done has, I mean, it's good in one way because it was normal, but it's obviously, unfortunately, hasn't solved all your problems and things. But I think maybe where it has been useful is that often for patients such as yourself, where there's lots of different symptoms and you possibly have a few conditions going on, it's often quite helpful to be able to know, okay, we can work out in a bit more detail what actually the role of light or the role of the environment is here. And did you find that getting more information was actually helpful for you in terms of empowering you a little bit to understand a wee bit more about your condition?
Definitely helped. And to hear the testimonies of other people who have been to the meetings as well, that was very encouraging. I didn't feel so alone. I didn't feel as if it was all in my mind, you know.
And I think what you mentioned there is our patient engagement program. And so that's been something that really has developed. I mean, as I say, our service has actually been around for 50 years, so a very long time. And we've always asked for feedback from patients in terms of fundamental things like, was the waiting time acceptable, etc. But actually, it came about, and also through discussions with yourself, Rod, that we maybe weren't capturing what really, really matters to our patients. So what really does matter to our patients. So in 2019, before the pandemic hit, we held an event at the V&A, which you went to. And that was really just a sort of open house to have a very open discussion with patients and all the Photobiology Service staff there as well about what matters. And what, interestingly, what came to light was, and I think it was very clearly shown in your case, is that often patients would wait years and years to be taken seriously or to be referred up, because they'd go and see their doctor and there would be nothing to see. And so they would take a long time to be referred for testing and further investigation. And also that actually what mattered to patients was not necessarily all the things that us as the medical team had been thinking about. So we have since then embarked on a sort of series of different engagement events, one of which is these podcasts to try and just raise awareness about people who have either sun-sensitive or sun-aggravated skin conditions. But also we do a twice-yearly newsletter about photosensitivity in our service. We have twice a year, at present virtual on Teams, patient engagement events. And we've developed what we call a red flag card system that we've sent out to all primary care practitioners in Scotland, just to sort of put sun sensitivity and abnormal aggravation and reactions to sunlight out there on the radar, really, just to try and raise awareness. So this is part of today, really, and thank you very much for that. But one of the things we have found is that patients have really liked getting information, because it does put you then in a position of, even if we can't solve the underlying problem, possibly make you more in control and aware of it. And I think you mentioned earlier on, Anne, before we started today, that actually before all this you hadn't even particularly been aware of any particular link with aggravation by sun. Is that right?
Yes and no. Because I've always had this condition, it's difficult for me to pinpoint when it actually first started to happen.
I think that's right. I think it's difficult when you've had something for 30, 40, 50 years, trying to work out, and do the joints link in with this, and does this link in with this, and does the fatigue. So it is very, very difficult, isn't it?
Difficult
indeed, exactly. Yeah.
But the skin condition definitely has been here a long time as well. At the moment, I'm good. But next week I might not be, you know. Just, you know.
I mean, a question I've got for both of you is just, you know, skin creams and sun protection factors, are they useful in this condition?
Well, you'll tell us in your case, Anne, I'm sure. They can be helpful, but I think...
They can be helpful, but a lot of time it doesn't make any difference. But the sun sense, I never go out without it on.
And is SunSense a specific one?
So SunSense is one that we at present have been able to prescribe, although Availability of sunscreens on prescription is difficult.
Mine stopped, and I just went into a panic and didn't know what to use. But I've now got one. I've got a big bottle.
So that's the sort of thing you put on before you go out for a walk.
Yes.
You live up in Forth, and you're out and about. You were describing maybe going for walks earlier on today.
Yes, it goes on.
So you put that on before you go out.
Yes, definitely.
We do find that patients with either light sensitivity or light aggravation, that in terms of the sort of taking care in the sun, the emphasis is sort of particularly on shade and hats and clothing in sunny times of the year. There's no such thing as a sunblock. So the sunscreens will offer at best partial protection. And if you're thinking about protection against a normal sunburn, you can divide the number on the bottle by 3 or 4 to get the real level of protection with any sunscreen. And that's just for normal sunburn, if you see what I mean. Because the sort of studies have been done that show we can't use sunscreens at the amount and thickness that we need to get that number that's on the bottle. So sunscreens in a way can almost offer a false sense of security, because you can think, great, a factor 60, I can go out for 60 times as long.
Factor 50 is sometimes,
in actual fact,
I've never been a sun lover, so that's not a problem.
But the other thing is actually what we've increasingly done and do is to advise our patients not to totally sun avoid. And this was something that with the pandemic we've sort of increasingly done, because pre-pandemic, we actually paradoxically used to use quite a lot of light treatments to try and desensitize and harden people. And then when the pandemic hit, we couldn't use hospital-based light therapy. So we actually developed a patient information sheet for trying to advise patients to try and naturally harden and naturally get some exposure. And that's in many light-sensitive conditions and in some light-aggravated conditions, getting low levels of sort of sub-triggering levels of exposure is actually much preferable to totally sun avoiding, because if you're totally sun avoid but then you are caught out, you're going to find that you're more sensitive.
And you'll get caught out with your vitamin D.
Yes, exactly.
That's why
calcium and all that.
I
take vitamin D.
I take a vitamin B complex, fish oil, anything and everything.
Yes.
I'm more on the healthy, natural things rather than, I don't take a lot of multivitamins because I get plenty in my food. I need the vitamin D and vitamin D.
And do you find that being careful with the sun helps minimise the number of flares of your skin that you get?
Yes.
Does it make any difference, do you think, the sun protection to any of your other symptoms with your chronic fatigue or your joints?
No, I don't think that makes any difference. No,
so I think
so
they're probably quite distinct, aren't they?
I can go to bed one night perfectly normal, had a great day, no skin problems for a few days, and I can wake up in the morning with a swollen face.
Yes.
I've changed all my bedding. I don't have feathers. I've done everything to lessen. I keep a window open for fresh air circulation, and I do everything I can to help myself. But it's still very restrictive. And over the years, the doctors have suggested antidepressants. I don't suffer from depression. I just suffer from trying to cope with these problems that are in my life. So I've refused them.
What are your coping strategies?
Well, when I know there's a breakup and I get some little signs, I can feel my heat, can feel my face warming up, and I think, oh yes, right, okay, we're not going out today. I do my best to cope with it. When it just gets too much for me, there's not anything I can do other than just be in the house.
And do you find you're much better in the winter, or is it not as seasonal as that?
It's not seasonal. I don't think it's seasonal.
And that's probably why you weren't so aware of any link, actually.
Yeah.
Any other little suggestions for other people from either of you, from clinical side or as a patient, that would be useful to other people?
I think it'd be useful for other patients to have conversation in front of each other, to know how they cope with things and what their symptoms, what causes. And
realising that they're not alone, that there's a lot of people out there.
How have you found family and friends in terms of their understanding of your condition?
Very understanding. It's hard sometimes on the grandchildren. They don't understand why Nana's always tired all the time and can't do certain things. But the older children, they prefer me, like I said, to yourself. When I go down to Glasgow for a visit, they've got a bed ready because they know the journey. It's has its tail on me.
Yeah.
So they've really adapted with
Yes.
you and
Yes,
learned
they've adapted.
to help you, which is
Yes,
wonderful.
Yes, yeah. No.
Yes, and I think it's difficult because you obviously got a few different conditions
I
going
know,
on, and
I
I
know.
think the sort of light side of it here and the light testing side of it here
Mhm.
has probably been helpful. Hopefully, it's been sort of slightly helpful in trying to pick out one aspect, this sort of skin.
It's been very encouraging.
Skin aspect of it.
Yes, it has been helpful.
Mm,
Yeah, definitely.
But I think also you do very clearly show through your story how having a chronic skin disease over many decades can really take its toll on life. And I think one thing is to say that I would challenge anyone with a chronic skin disease not to have some psychological impact on their life.
I would have days when I'm quite down, but I'm very optimistic. I'm very positive.
Yeah.
Person, and I refuse to allow this to rule my life, as it were.
Yes. Yeah.
I do my best.
Yeah.
I really do my best.
Well, Anne, thank you so much. Thank you for
so
sharing
much.
all of that.
Yes,
And Sally,
thank you so much. Thank you.
as well. And I think that's hopefully going to be very useful to a lot of other people.
Yes.
And I think the other thing to say with that is that in your situation, and if you think back all those years, I think if you have got a chronic skin problem, then do go and see your doctor and do push to be referred, because actually that's what we're here for as a light testing service. And sometimes we will test and it'll be positive, and other times, as in your case, we'll test and it'll be negative, but that's just as important. Sometimes ruling out some types of light sensitivity and being able to say, well, we think this is aggravation rather than actual causation, if you see what I mean,
What causes,
are just as important.
What causes it? Sorry to interrupt you, but what causes it?
Well, seborrheic dermatitis in itself is actually a very common condition, but obviously can have a variety of severities. So it can be just very mild to the point where someone might just feel they've got a bit of dandruff, through to more severe disease like yourself, where you describe it being very inflamed and weepy and basically stopping you from going out. And as with quite a lot of skin conditions, we don't fully understand its causation, but we think that we all have sort of yeast on our skin as part of normal life. And in some people, that yeast has a sort of propensity to overgrow, and it can present itself as an itchy, red, inflamed dermatitis. And the typical way it would present would be sort of scaling and redness in the eyebrows, down the sides of the nose, in the scalp. And when it can get more severe, as you described with the flare-ups, it can obviously be pretty troublesome. It can be flared by environmental things like heat, like sweating, like light, for example.
This is fascinating because I've got that.
All right, okay. So we're going to have these
we're going to have another session.
Disease confessions now. And paradoxically, you can use light therapies for this condition, but the problem is because of this potential for aggravation, you can also have a high relapse rate afterwards. And because those sort of yeast on our skin are there normally and we can never clear them completely, it is a condition that often will relapse and come back, and it's very hard to get complete cure from it. So you usually will always need to have some maintenance treatment with either an anti sort of yeast shampoo or you do use the ketoconazole.
I've had hair loss, all body hair loss, eyebrows down, and my hair receding at the top as well.
Yes, so that's another condition you have, isn't it? That's frontal fibrosing alopecia.
That's Dr. Dawn.
You also have that. So I think what Anne, you're sort of really showing is that you have got rather a lot of different conditions going on, actually. That. And
that's why I've wondered, are they all connected in some way? Has something caused this? Is it is it the chronic fatigue? Is it all just...
They're probably not all linked, but it's difficult for me to say conclusively.
This has been absolutely fascinating. Thank you so much.
One person with so many.
Thank you so much.
And if you've enjoyed this podcast and would like to learn more about light sensitivity, please have a listen to some of our other episodes. There's also a wealth of information on the NHS Photobiology website. Details about how to find this can be found on the podcast description. And thank you.